Okay, welcome back, everyone. Dr. Linder here. We're going to be looking at muscles of the head and the neck. We are on part 2. We're going to focus a little bit on the eyes. Let's take a look at the ocular muscles. So this is there are 6 muscles of the eye. There are going to be, let me see if I can find my mark pen here. There are going to be 4 of them, 4 that have the term rectus in it, as we can see here. And then there are going to be 2 of them that have the term obliques, oblique. Okay, so we have 4 rectuses and we have 2 obliques. Now the rectuses are going to be named by the position that they're located. So if we see a muscle directly on top, it'll be the superior rectus. If there's a muscle closer to the nose, it'll be the medial rectus. If there's a muscle far away on the outside, it's the lateral rectus. And if there's a muscle way underneath the eye, opposite of the superior rectus, we call it the inferior rectus. Okay, so here on the top of the eye, this is a bird's eye view looking straight down. That is the superior rectus. And you could see just adjacent to it right here is the inferior rectus, right? That angle that the camera took it, we could see it and it would go right underneath and attach probably right under there, but on the inferior surface. Okay. Here's the nose. So on the inside, right here, that is the medial rectus. And on the opposite side, on the lateral side, right here, is the lateral rectus. Now there's a superior oblique and an inferior oblique. Right here, I'm going to see if I can outline it, coming around this way, going through that groove. That's your superior oblique. And then right here, coming around this way, that's the inferior oblique. I'm going to see if I can show it again in another view. So here is a lateral view. We're looking at the right eye from the outside. So this is the lateral rectus. This right here would be the medial rectus. This on top is the superior rectus, but we could see that it's cut. And now we're looking from lateral to medial because here's the nose. And right here is the superior oblique. So we can see it coming up this way. And then it goes through this tunnel called a trochlear. It loops around and attaches like that. That's the superior oblique. Okay. And the superior oblique, there's a little mnemonic that I call SO4 LR6 all over 3. And what this is telling me is that the superior oblique, SO4, superior oblique, is innervated by cranial nerve number 4, which is called the trochlear nerve. And it goes through this trochlear tunnel, this groove right here called the trochlear. So the superior oblique is innervated by cranial nerve 4 called the trochlear nerve going through that trochlear groove. The lateral rectus is innervated by cranial nerve number 6, which we would write like this, Roman numeral 6. Lateral rectus moves the eye outward. It just so happens that the movement of the eye away from midline, what do we call it when we move a body part away from midline? We call it abduction. This nerve is called the abducens nerve. Abducens, pretty cool, right? Abducens nerve, cranial nerve 6, lateral rectus. Lateral is outside, pulls the eye away. Abducens nerve, cranial nerve 6. So SO4, LR6, all over 3 means that all the other eye muscles, the other four muscles, are innervated by cranial nerve number 3, which is the oculomotor nerve. Oculomotor. Okay. Looking at the eye, here's the nose right here. Here's the nose. So here's your medial rectus. Right underneath, coming around this way, that's your inferior oblique. Inferior oblique muscle. Okay, I think there's one other, I think I have one other picture I'd like to show you. Let me see if I can find it. It's on my desktop. Let me move this around. I think it's right here. Let's see if it'll open up. There we go. So again, let's see if we can see them all at one shot. So here's the inferior oblique going around to the bottom. There's your superior oblique going around to the top. Here's your medial rectus all the way on the other side. Lateral rectus all the way on top. Superior rectus. And the only one you can't see would be the inferior rectus. But the superior oblique, we could see, goes through the trochlear. That's why it's SO4, 4 is the trochlear nerve. LR6, abducens nerve. And all the other eye muscles, whether it's the superior rectus or inferior oblique or medial rectus, they're all going to be cranial nerve number 3, oculomotor. Okay. Let's see what else we have here. Let's finish up. So now we have the SCM muscle. And remember, on exams, you don't want to abbreviate. So SCM stands for sterno, because right here, this originates on the sternum. So that's the sternal division. Then here, we have the clavicular division. So we have the sterno, Clido for clavicle, M for mastoid, sternocleidomastoid, SCM. Here's the left SCM. And again, you can see it really beautiful right here. Look at that sternal division going right to the sternum. Here's the clavicular division going to the clavicle. So we have the sternocleido, and the insertion is on the mastoid process, sternocleidomastoid. When the left SCM contracts, right, this is the left SCM, it's going to rotate the head to the right. So when this contracts, it's going to turn the head in that direction to the right. And it will laterally bend this way. So it will do left lateral bending, bring in the left ear to the left shoulder, but it'll rotate the head to the right in the opposite direction. Let's look at some of the posterior muscles. Now, this is important to understand the actual anatomy here. So on the right side, this is the right, and this is the left side. We're looking at this individual from the posterior. On the right half, I'm just going to draw this black line here. So everything to the right, this is superficial. So the trapezius muscle is superficial. If we were to dissect this, see, it even says here, superficial side, deep side. So the only reason why we can see these 3 muscles on the left is because we were able to dissect and pull away the trapezius that was on the right. All right, so you need to be able to understand that if we don't see these muscles here, it's because we're looking at the trapezius, which is covering them up. If we don't see the rhomboid minor, and we don't see the rhomboid major, and we don't see the levator scap, or splenius capitis, or semispinalis capitis, well, it's because the trapezius is superficial to them. Here is the upper traps, here is the middle traps, and here is the lower traps. Notice the upper trap fibers run in this direction. The middle fibers run in this direction. And then the lower fibers run in this direction. And the direction of the fibers are going to dictate how it's going to move the scapula. So the upper traps will elevate the scapula. The lower traps will depress the scapula. And the middle traps will adduct the scapula. Will move the scapula to the midline, which is adduction. So it will adduct the scapula. Okay, so on the right side, it's superficial. On the left, once we peel away the trapezius, we can see the levator scapula right here. Levator sounds like elevator, right? What is it going to elevate? It's going to elevate the scapula, because the levator scapula, it goes from C1 to C4, the transverse processes, the TPs, and it goes to the superior angle of the scapula. It goes to the superior angle. So it's going to elevate. It's going to be like shrugging your shoulders up. Like if someone asks you a question and you say, I don't know, that's levator scapula doing that. So C1 to C4 transverse processes, and it inserts on the superior angle. And it's always the insertion that moves. Okay, so then we have splenius capitis, which is all of this here. Splenius capitis. And then we have the semi, right? Semi is like half. Semispinalis capitis, capitis for skull. That's the semispinalis capitis. Okay, so we have upper traps here, middle trapezius here, lower trapezius here. If we dissect that, we can see the levator scap, splenius capitis, and then the semispinalis capitis. And I labeled this one before. I call this rhomboid minor. I use a small m. And then here's rhomboid major, big M. And remember, when we did the skull, the minors are always above majors. This is C7, spinous process. This is T1, and that's where the rhomboid minor goes from. And then from T2 all the way down to T5, it's a little bit lower than this, obviously. That's going to be rhomboid major. Okay, so looking at the three muscles, the four muscles we just did, again, focus here on the right side is superficial, and on the left side is deep. So we can see the upper trapezius fibers here. We can see the middle fibers here. And then we have the lower fibers of the trapezius here. So the upper fibers will elevate the scapula. Lower fibers will depress the scapula. And then the middle fibers will adduct the scapula, also known as retract the scapula. Retraction, which is bringing the scapulas to midline. We dissect that away. Here we have levator scapula, splenius capitis, and the semispinalis capitis. And then I'll label this again, as I did before, rhomboid minor, rhomboid major. Both of these can retract and adduct the scapula, but also it will rotate that upwards, which brings the glenoid cavity downward. So we say that the rhomboids adduct, but they downward rotate the scapula because the reference point is actually the glenoid cavity. If you look at these fibers, when these pull up in this direction, when these pull up, the opposite side has to rotate down. And that's where the glenoid fossa is, which is the reference point. So we say the rhomboids adduct and downward rotate the scapula. The downward rotation refers to the glenoid cavity. Okay.